name is Lissa Brown. We are in Flourtown, Pennsylvania, and we have 2 dogs. So we have Bart and Gus. Gus is a little boxer. We were ready to go on vacation, and when we go on vacation, most of the time dogs go with us. And then all of a sudden Gus started to throw up, and took him to the vets, and she heard a small heart murmur.
Melissa Brown is a wonderful client. She's willing to do pretty much anything that needs to be done for her pets and always has over the years. When we heard the murmur in this dog, in Gus, we knew that boxers in general have a lot of heart issues, something called boxer cardiomyopathy. We have a referral practice in Langhorne, Pennsylvania that we refer to, and so I referred Gus to Dr. Bosbali so she could figure out what was going on and do an echocardiogram, which we don't have the ability to do here.
So the echocardiogram did show some congenital abnormalities with his heart, particularly the aortic valve, and his heart was dilated, and that was unusual for such a young puppy. He was hospitalized over a 24-hour period. We would try one drug, it would break the arrhythmia, but those breaks in this fast heart rate were very short-lived. And so more and more we started to suspect some kind of accessory pathway, and we decided what we really needed to do was to get Gus to the University of Pennsylvania, to Dr. Oyama.
My husband and I took Gus with the heart monitor and the IVs in the car down to Penn, and Gus was admitted right then into the ICU.
When we saw Gus, we saw him, I think, over the course of 20 days, maybe 4 or 5 times. And he was unable to be controlled outside of the hospital. So when he was in the hospital on IV medications, his heart rhythm was very well controlled, but outside of the hospital on oral medications, he was very difficult to keep his heart rate under control. So we ended up talking to Dr. Wright in Ohio, who's one of the only veterinary cardiologists in the United States that does this particular procedure. Looking at Gus's case, she felt he was a good candidate to have the radiofrequency ablation done.
Gus had arrested already once, so we knew that it was a balance of medicines. And my job was to try to keep him going and then get in that car and get to Cincinnati the second they could take him.
The ablation procedure itself is one in which we introduce catheters through veins in the neck and legs, so we don't do an open chest procedure. It's all done with catheters that get fed up into the heart, and we map out where this abnormal rhythm is. It basically is an extra electrical connection. That's what Gus had. He doesn't need that, so we go in and we have to find it precisely, and then we ablate it or destroy it with essentially glorified electrocautery.
We stayed one more night, and then the following morning he was just like a crazy little man. He was shaven, still cachectic looking, but wagging his tail and ready to go. It was immediate cure. You should be able to cure these dogs. We don't want these dogs dying because it's a cure that can happen. She's the only one in the country that does it.
What owner after owner has told me is they thought they had this great little sedate puppy who was just the best puppy in the world, and now they're a true puppy after the procedure. So I've had a few owners who ask me to can you put a little back, just a little?
Oftentimes your family veterinarian will refer to a specialist, and that will take care of the problem. In this case, there were 3 specialists involved that all basically worked together to move Gus along to end up with Dr. Wright in Ohio.
I saw him yesterday for his yearly checkup. He was perfect. His electrocardiogram was normal. His blood work is all good. He's a happy, gorgeous dog, living a very happy life. Thanks to Melissa Brown's willingness to, go forward with what treatment needed to be done.
The whole collaboration effort of specialists talking to specialists and really having their focus on the patient and talking to each other and really coming out with a plan to help the patient.
Gus wouldn't be here, and I'm sure there's a lot of other dogs that wouldn't be here unless we had that team. It is the veterinarians and it's the support staff that all work together to let me keep my doggie.